July of 2019, I accepted my dream job to come back as CEO, and after a 2-day final interview with about 140 candidates, one of the questions I'd never received was, how would you deal with a pandemic your first year on the job? And I can recall our journey started in March. So March the 17th, we had our FirstHealth Board of Trustees meeting, and a large part of that agenda was our COVID prep. COVID was starting to pop up around the state and the region. We had not seen a COVID case, but we dedicated a large part of the agenda that evening to COVID preparation. Little did we know the very next day, on the 18th of March, we would be tested. Our first positive patient occurred and tested positive at our Hope campus, and that completely changed. And one of the things we also began that week was a daily phone call. And we actually were doing it twice a day the first few weeks of the pandemic. And we had all 180 leaders of FirstHealth. We had our physician leaders, we had our community partners, including Pinehurst Medical, Pinehurst Surgical, the health department, county emergency management. They were all on the call. And one of the things that was important to me through this entire thing, and it's still occurring today, is that everybody would know what I would know. Transparency on our PPE, our test results, are there any key issues that we need to address as an organization? And we began that very first week, and I thought it was a very effective strategy. I wanted to remind everybody through our pandemic what my commitments were and my vision for the organization. And it was threefold: to create the best place to work in healthcare in the country, to create a zero harm organization where our harm events would get to zero, and to build a comprehensive cancer center. Little did I know through the pandemic it would challenge really all three. To me, of the three, the most important thing to me in the organization is the best place to work. Our culture, our morale, it drives every single thing that we've done. And through the pandemic, it ultimately challenged us. We went from an average daily census across our network of well over 300 to well under 200. And when the governor mandated we had to stop elective surgeries, which was the right thing to do at the time, our elective surgeries went from almost 50 a day to the teens per day. Our emergency room visits across our network, which would average 400 to 500 a day on any given day, went down to 200 and less. And what that did is it had an impact. We're a volume-based organization, so we flex up when we're busy and we flex down when we're not. Literally, we had thousands of employees immediately impacted by COVID. Their hours were reduced. What struck me the most, I was on one of our nursing units one day, and one of our new nurses stopped by and she kind of cried on my shoulder. Her and her husband had bought their first house. She was going from working 40 to 48 hours a week to now 20 or 24 hours a week, and she was struggling if they were going to be able to make their first payment. And I went down to dietary department, and a similar story. One of our dietary employees, 4 kids, but when census drops nearly in half, that employee didn't know if they'd be able to make ends meet for that month. And there's just no good answer for that. But the impact it had on morale was dramatic, and it was literally overnight. And that hurt me as a CEO. I think I'm here to make sure that those things don't occur. And some of the things I'm most proud of through all of this, did people get furloughed when we had to close our fitness centers, which was a requirement by the state? Yes, we had to furlough employees, and 1,000+ employees' hours were cut back, but we didn't lay off one employee. And my commitment through this is we weren't going to lay off one employee. And I'm very proud of that. I think we've kept our culture in the forefront. The other thing through this is, I've heard the term healthcare heroes, and that term's really come to life. When you see our employees today, and through this entire pandemic, to see these young men and women, physicians and non-physicians and other clinicians, gown up in protective equipment and masks and gowns and go in and treat these positive COVID patients, it just is amazing. Their leadership, their courage, and they're having to go home to their families. And I have seen healthcare heroes on the front line, and we have a lot of healthcare heroes at FirstHealth. I will never be able to thank those employees and physicians enough through this entire event. They have been our backbone of the organization, and it's my commitment to make sure this is the best place for each of them to work in healthcare. I think our next iteration was probably mid to end March, and as COVID started to spread, we actually had our first inpatient admission, and we were prepared for that. We also dedicated several units, a medical unit and one of our ICU units, to cohort COVID patients. That was done well in advance. Kudos to our medical group and our physicians. I thought we started literally 2 weeks into the pandemic, drive-up testing, both in Pinehurst and at Richmond. That was a game changer for the community to be able to have the drive-through testing options open for the pandemic. We have literally treated and tested thousands of patients through our drive-up clinics since March, and I thought that was really an important part. The other thing I thought the administrative team did very early on is we saw the impact it was going to have financially. And on our own, without laying off one employee, we cut back $17 million in discretionary spend financially for the organization. Things that we could do without or could hold or postpone just to make sure the financial viability of the organization was in place. And I thought those were some very good early moves. The drive-through testing, our discretionary spend. The other thing I was very proud of, very early on, there was a PPE shortage, but we were immediately on supply chain calls. And within a few weeks and few months after our first cases, we had a steady pipeline of PPE. So we were never, ever out of PPE, and that was really important for our culture and making sure our employees felt safe. As I was doing rounds across the organization, there were a lot of their friends and coworkers in other organizations and health systems across the country that couldn't say that. We always had masks, we always had PPE. We were doing our absolute best to keep our staff safe. I think one of our great secret weapons at FirstHealth is we have over 1,000 active volunteers in our system. They make such a difference. They staff our front desk, they deliver flowers, they do a host of different events for the organization. One of the hardest things through our pandemic is we had to let our volunteers go for their safety and our safety. But I personally want to thank every single volunteer for their commitment to the organization and what they mean, and we can't wait to have them back in full force. They are a huge part of our organization and makes it very, very special. You know, a couple of breakthroughs in early April, our physician group, telehealth. We've been talking about doing virtual visits for quite a while. Our virtual visit platform just launched and was very, very effective. We were literally having our primary care physicians see thousands of patients with virtual visits and phone calls versus in person. That was really one of the positives of COVID, is I don't know if we've ever gotten to that breakthrough without it. I think another milestone in early to mid-April, we lost our first patient due to COVID. And when we had that first patient death, the entire building felt it. It changed. It went from being something we're treating to this is becoming very, very real. And when I mention healthcare heroes, the staff that we have on our Med Neuro ICU, the staff that we have on our 4 medical unit, the staff in our emergency room, they are truly healthcare heroes. They're the ones on the front lines that have been treating this from day one. The physicians that staff those areas, or staff that are there, they are absolute healthcare heroes. You know, one of the things I believe in, you can't ask your health system and hospital to support its community if that community is not supporting its local hospital and health system. One of the real breakthroughs and ahas for me through this entire pandemic has been the community support for FirstHealth. Let me start with the Pine Wild community. Very early on in the pandemic, PPE was in short supply, supply chain was drying up. The Pine Wild community stepped up and literally gave us 5,000 plus masks that they made. What a difference that made. They also gave us meal cards that we were able to feed our staff and keep morale going. And literally, I did over 200 handwritten thank you notes to different churches, organizations, people that have just given back to this organization for healthcare heroes, and we needed that. Some of the prayer circles done in front of the hospital. We had local law enforcement, EMS, do drive-bys of every single FirstHealth campus. What that did for the morale of each and every building was miraculous. It got us through a lot. I also wanted to mention SunPath. It's a company out of Rayford, North Carolina. Very fortunate, one of our employees that works at our Hope campus, husband owns SunPath. They make equipment and supplies for parachutes. And literally through the PPE shortage, he literally stopped one of his assembly lines for several weeks on the time, and they went from making parachutes to making masks for the staff. And they donated those masks, 200 to 300 a day, every day for multiple weeks in a row. They wouldn't take any money, they wouldn't take any thanks or recognition. They just wanted to do it to protect healthcare workers in our community. And I think another testament for what FirstHealth means for our community and the support our community has given us is just incredible. want to personally thank all of our community members that gave, donated, sent letters of support, masks for FirstHealth. It was a game changer for morale in our organization at a time that we really needed it. I truly believe healthcare heroes work at FirstHealth, and thank you for honoring, celebrating them with your gifts and philanthropy. Thank you.